Hi, this is Dr. Kaan. We're back here with the ACL Academy. Today, I am going to talk about one of the most popular questions that I get is, when can I start running after my ACL surgery? So I'm going to get into that and go over the key factors or prerequisites that you need to have before you can start a running progression. Before I do that, if you guys have been following the page and have found value in the content, please like and please subscribe to the channel. Please share with a friend. So let's talk about jogging. Well, jogging usually starts anywhere from the 4-month range to as late as maybe even the 6 or 7 month range, depending on how the process is going for the ACLer. I will tell you, running is more dependent on physical attributes, meeting certain physical milestones, than it is as far as time out of surgery. So yes, time out of surgery is important for one thing, and that is the graft is going through its own process, right? They take either a piece of your tendon, whether that's from your quad, your hamstring, your patella tendon, or they borrow a donor graft. And when they implement that into becoming your new ACL, well, it has to go through a process in order to turn to a ligament. Now, usually in most of these cases, 3 months is the sweet spot where they're past that weakest point range. And this is where I will start to strength test the individuals to make sure or to get a baseline of what their strength numbers are at. Will be important for us to determine when we can run or not. So when we're talking about running, the earliest these days that I will start returning an athlete to running is around the 4-month mark. What we're looking for, though, is certain prerequisites. So what are those prerequisites? We need to have one, little to no pain with everyday activities, okay? And little to no swelling in the knee joint. Those are two musts, right? We want to make sure that the athlete, through everyday activities such as walking, stairs, navigating in and out of the car or in and out of a chair, all these things should be basically pain-free, and the ACLer should not be getting any swelling with these activities along with their workouts and their strengthening. Secondly, is their range of motion. Their range of motion, both on the extension side, the straightening, as well as the flexion side, the bending, should be symmetrical to the other side. So we want range of motion to be full before we start initiating a running progression. And the last piece, which I believe is the most important piece, is strength numbers. We need to be objectively tested. So you specifically have to know what your quad strength is, what your hamstring strength is very, very important. Now, there are a few different ways that we test strength that can be either done, which is the gold standard, on a computerized tester. Secondly, using a handheld muscle device tester where you're pushing into a device which is giving you an objective readout, or we can do this through 1-rep max testing on a piece of gym equipment, specifically like the knee extension machine, hamstring curl, leg press. All these will give us a readout, and what we're looking for is comparing right side versus left side. And when we test, in order to start jogging, we want our numbers, our surgical leg, to be 80 to 85% of the other side when looking at quads, hamstrings. Super important, and that's the cutoff that we do use. And then at that point, if you're meeting all criteria, we would start a walk-run progression. So when we clear our clients to start a running progression, it's not that we're giving them the all clear where they can just start jogging and ramping up and increasing as much as they feel like it. We need to put them on a progression where we're doing a walk-run for increments until and seeing how the knee responds. And then we're week to week, we are increasing that. So for example, the first level that I start my clients on for their running progression would be a total of 1 mile. But what they're doing is they're alternating between a walk and a jog. So usually what I'll have them do is walk 1/10 of a mile. So that's 1/10 of a mile, followed by a jog of 1/10 of a mile, and then repeating that until they reach a total of 1 mile. So it's a lot more walking time-wise than it is jogging. Then what we do is we monitor the knee. After they finish their first running progression, we monitor the knee. Any pain, any swelling, any stiffness, any adverse effects, anything. How did the knee respond to the run? And if it responded well, we monitor for 24 to 48 hours. If it does go well, then we will run again 2 days later. We will probably stay at that same level. And if a second time it goes well, we'll move on to the second level. So each level is a little bit more advanced, where we're adding a little bit more running versus walking. But my running progression has about 11 levels and completes at a 3 mile run. So, and I understand running is not for everybody, but it's very important that you do take your knee through this process, because that pounding is a good way to stress the knee and see how it responds and make sure that it can respond in a normal way. So just to recap here, okay, we want to run. Well, when can we run? This is not necessarily time dependent. Okay, this goes by physical characteristics and reaching certain milestones. That is no pain, no swelling, and no issue with everyday activities such as walking, stairs, getting in and out of a car, getting in and out of a chair. Okay, those should be very, very clean. Secondly, we want full range of motion. That's full bending, full straightening. Okay, very, very important, to be symmetrical to the other side. Some people will tell me, well, I can get my knee all the way straight. Well, your other knee can go into hyperextension. So it's important to match that. Then lastly, strength testing. It's important that you start strength testing at around month 3. And where we want our strength numbers to be is between 80 to 85% of the other leg. Once we achieve that for quad strength, hamstring strength, we're comfortable getting started on a running progression. So no pain, no swelling, full range of motion, strength numbers 80, 85% of the other side. And that is when we can start a walk-run progression. Usually starts around month 4 or later for this recovery process. Hope that makes sense, guys. And if you have any questions about that in particular, drop a comment below. If you found some value in this video, please like and subscribe to the channel. Please also share with a friend. I'll see you next time. This is Dr.